What is attention-seeking behavior? Attention-seeking behavior is a pattern of actions or behaviors that an individual exhibits to gain attention or recognition from others. It is a common behavior in human beings, especially in children and adolescents. Attention-seeking behavior is usually seen as a negative trait, but it is a normal part of human behavior. In psychology, attention-seeking behavior is a topic of interest because it is associated with several psychological disorders, including personality disorders, anxiety disorders, and mood disorders. Attention-seeking behavior can manifest in different ways, depending on the individual's personality, age, and social context. Some common examples of attention-seeking behavior include interrupting conversations, exaggerating or lying about accomplishments, wearing provocative or unusual clothing, engaging in risky behaviors, and seeking sympathy or pity from others. These behaviors can be intentional or unintentional, and they can vary in severity. The underlying motivation for attention-seeking behavior is often rooted in a need for validation, acceptance, and belonging. People who engage in attention-seeking behavior may feel insecure, unimportant, or neglected, and they may use attention as a way to feel valued and appreciated. Attention-seeking behavior can be a way to cope with stress, anxiety, and depression, and it can also be a way to compensate for a lack of positive attention or affirmation in one's life. In psychology, attention-seeking behavior is often associated with personality disorders, which are mental health conditions characterized by long-term patterns of behavior that deviate from cultural norms and cause significant impairment in social and occupational functioning. One example of a personality disorder associated with attention-seeking behavior is histrionic personality disorder, which is characterized by excessive emotionality, attention-seeking, and dramatic behavior. People with histrionic personality disorder may dress provocatively, engage in seductive behavior, and exaggerate their emotions to gain attention and admiration from others. Attention-seeking behavior can also be a symptom of other psychological disorders, such as anxiety disorders and mood disorders. For example, people with social anxiety disorder may engage in attention-seeking behavior as a way to reduce their anxiety in social situations. They may try to draw attention to themselves in order to feel more comfortable and confident, or they may avoid social situations altogether to avoid feeling anxious. Similarly, people with bipolar disorder may engage in attention-seeking behavior during manic episodes, when they may feel more impulsive, outgoing, and energized. Attention-seeking behavior can also be a problem in children and adolescents. Children who engage in attention-seeking behavior may disrupt class, act out inappropriately, or seek negative attention through aggressive or defiant behavior. Adolescents may engage in risky behaviors, such as drug use or sexual promiscuity, in order to gain attention and feel more mature and independent. Attention-seeking behavior can be a normal part of development, but it can also be a sign of underlying psychological problems, such as ADHD, depression, or anxiety. In conclusion, attention-seeking behavior is a common and normal part of human behavior, but it can also be a sign of underlying psychological problems. It is important to recognize and address attention-seeking behavior, especially in cases where it causes significant distress or impairment in social and occupational functioning. Psychological interventions, such as cognitive behavioral therapy, can help individuals develop more adaptive coping strategies and improve their social skills and self-esteem. With the right support and treatment, individuals with attention-seeking behavior can learn to form healthier relationships and live more fulfilling lives.